Welcome to Lesson 3.4 of the Grant Architect course. In our previous lesson, we explored national data sources that establish context and significance. Now we move to the most powerful level of the data hierarchy, local data. Local data proves that national problems affect your specific community, the place where you propose to intervene. This is where your needs statement becomes truly compelling because it demonstrates that the problem is not abstract but concrete, affecting real people in a specific place. By the end of this lesson, you will understand what gray literature is and where to find it, how to access local health assessments and municipal data, strategies for locating community-specific evidence, and how to combine local data with national benchmarks for maximum impact. While national data establishes context, local data makes your needs statement compelling. Relevance is established because local data proves the problem exists in your specific service area, not just somewhere in America. Funders want to know that their investment will address a real problem in a real place. National data alone does not prove that your community needs intervention. Specificity transforms abstract statistics into concrete community impact. 40 million Americans face food insecurity is important context, but 12,000 residents of Jefferson County experienced food insecurity last year is actionable. Local data makes problems tangible. Credibility is demonstrated through deep community knowledge. When your proposal cites local data sources, it signals that you are embedded in the community, understand its specific challenges, and have done thorough research. This builds trust with funders. Comparison power emerges when local data is juxtaposed with national or state benchmarks. While the national diabetes rate is 10%, Jefferson County's rate reaches 18%, creates immediate impact. The comparison highlights that your community faces disproportionate challenges requiring targeted intervention. Gray literature is a term for research, reports, and information produced outside traditional academic or commercial publishing channels. Unlike peer-reviewed journal articles, gray literature is often produced by government agencies, nonprofit organizations, research institutes, and community groups. Examples include government reports from state and local agencies, community needs assessments conducted by hospitals or United Ways, white papers from think tanks and advocacy organizations, program evaluations and annual reports, conference proceedings and working papers, and data briefs from local health departments. Gray literature has distinctive characteristics that make it valuable for grant writing. It is often free and publicly accessible. It tends to be more current than academic publications, which can take years from research to publication. Most importantly for our purposes, gray literature often focuses on local or regional issues that national sources do not address. Gray literature contains data not available anywhere else. A community health needs assessment might be the only source for health statistics specific to your county. A local workforce study might be the only analysis of skills gaps in your region. This locally specific data is gold for needs statements. Community Health Needs Assessments, or CHNAs, are among the most valuable gray literature sources for local health data. Under the Affordable Care Act, nonprofit hospitals must conduct and publish CHNAs every 3 years to maintain tax-exempt status. This requirement has created a wealth of local health data that did not exist before. CHNA content typically includes health status indicators such as disease prevalence, mortality rates, and health behaviors, risk factors like obesity rates, smoking prevalence, and lack of insurance, access barriers including transportation, cost, and provider shortages, and community-identified priority areas based on stakeholder input. Access is usually straightforward. Hospitals must make their CHNAs publicly available and most post them on their websites. Search for the hospital name plus Community Health Needs Assessment. If a hospital serves your area, their CHNA likely contains relevant data. The value of CHNAs extends beyond the data itself. They often include community input from focus groups and surveys, providing qualitative perspectives alongside statistics. They identify priority areas that may align with funding opportunities, and they are updated regularly, making them relatively current sources. Local health departments are primary sources for community health data. County or city health departments collect, analyze, and often publish health statistics for their jurisdictions. Surveillance data includes disease tracking for reportable conditions, vital statistics like birth and death records, and outbreak monitoring for communicable diseases. This data may be more granular and current than state or federal sources. Assessment reports take various forms depending on the jurisdiction. Community health profiles summarize key indicators. Health equity reports examine disparities across populations. Behavioral risk factor reports mirror the CDC's BRFSS at local levels. These reports synthesize data into accessible formats. Program data from health department activities can be relevant. Immunization coverage rates, WIC program participation, childhood lead screening results, and other program metrics provide insight into community health status and service utilization. Access varies by jurisdiction. Many health departments maintain data portals or publish regular reports on their websites. Some data may be available only by request. Building relationships with health department epidemiologists can open access to data not publicly posted. They are often willing to assist organizations working on community health issues. United Ways and community foundations frequently conduct or commission community research that provides valuable local data. Community needs assessments from these organizations often span multiple issue areas including education, health, financial stability, and basic needs. They provide broad views of community challenges and may identify cross-cutting themes. These assessments typically combine quantitative data with community input. Community indicator projects track ongoing metrics of community well-being. Some regions have established indicator initiatives that update annually with data on dozens or hundreds of measures. These projects create longitudinal views of community trends and allow comparison across neighborhoods or demographic groups. Issue-specific research occurs when these organizations commission deep dives into particular challenges. A United Way might sponsor research on early childhood outcomes or affordable housing. A community foundation might fund studies of specific populations or neighborhoods. This research often fills gaps in publicly available data. Access is typically through organization websites. Look for sections labeled Research, Community Impact, or Data. Some regions have dedicated indicator portals that aggregate data from multiple sources. If you cannot find what you need online, contact the organization directly. They may have additional resources available. Local government agencies collect data that can support needs statements, though finding it requires knowing where to look. Planning departments produce demographic projections, which forecast population changes that may affect service needs. Land use data and housing studies address built environment factors. Comprehensive plans often include extensive community profiles. Economic development agencies track employment data at local levels, business formation and closure statistics, and workforce analyses. They may produce regular economic reports or special studies on sectors relevant to your work. Human Services departments maintain program utilization data that reveals community needs. Caseload data for SNAP, Medicaid, housing assistance, and other programs indicates how many people need support. Outcome reports from service programs provide evidence about what works and what gaps remain. Many jurisdictions now operate open data portals where they publish data sets for public use. Search for your city or county name plus open data to find these portals. Available datasets vary widely but may include crime statistics, code violations, 311 calls, permit data, and other information not available elsewhere. Education data provides important context for many proposals, not just those focused directly on schools. State report cards are required in most states and publish school-level performance data. These include test scores, graduation rates, attendance, and other indicators. State education department websites provide searchable databases of school data, though format and content vary by state. District reports often provide more detail than state sources. Districts may publish achievement data disaggregated by student groups, demographic profiles of students served, information about special programs, and local assessment results not captured in state testing. The Civil Rights Data Collection from the U.S. Department of Education provides federal data on school discipline disparities, access to advanced courses, teacher qualifications, and other equity indicators. This data reaches down to individual schools and is particularly valuable for proposals addressing educational equity. Access for state data is through state education department websites. For district data, check district websites or contact the data or research department directly. Building relationships with district staff can unlock access to data not publicly posted. Finding relevant gray literature requires strategic searching since these documents are not indexed like academic publications. A basic search strategy combines organization type, issue area, and location. For example, searching for County Health Department plus diabetes plus Jefferson County will surface Health Department reports on diabetes in that specific area. Be prepared to try multiple search variations and synonyms. Going beyond Google is often necessary. While Google may surface some gray literature, many reports are buried in organization websites where search engines do not easily find them. Navigate directly to relevant organization websites and look for sections labeled Publications, Research, Reports, or Data. Search within those sites for your topic. Asking colleagues and peer organizations about local data sources is highly effective. Others working in your field or community likely know what data exists and where to find it. Network connections can point you to reports you would never find through online searching. Building a mental map of who produces data in your community accelerates future research. Personal outreach to researchers and analysts at local organizations can also yield results. Many are willing to share unpublished data or point you toward additional sources. Sometimes local data simply does not exist for the specific measure or geography you need. Several strategies can address these gaps. Proxy data uses related measures to indicate likely conditions. If direct data on food insecurity in your zip code is unavailable, you might cite the percentage of students qualifying for free and reduced lunch, SNAP participation rates, or poverty levels as proxies that suggest food insecurity levels. Small area estimates from some federal sources model local data even when direct measurement does not occur. The Census Bureau's Small Area Income and Poverty Estimates program provides county-level poverty data. The CDC sometimes publishes county-level estimates for health measures. Check whether these modeled estimates exist for your topic. Primary data collection is an option when existing data is inadequate. Conducting your own community needs assessment, client survey, or focus groups can fill gaps. This requires resources and planning but produces highly relevant, locally specific data that you control. Acknowledging data limitations when necessary demonstrates honesty. If you cannot find local data for a specific measure, say so transparently while citing the best available evidence. Reviewers appreciate honesty about data limitations more than weak data presented confidently. The most powerful need statements combine national and local data strategically. The setup uses national data to establish context and significance. Nationally, approximately 12% of households experience food insecurity, affecting over 40 million Americans. This frames food insecurity as a significant national challenge worthy of attention. The pivot uses transition language to signal the shift to local focus. Phrases like locally, in our service area, or in Jefferson County signal that you are about to demonstrate local relevance. The transition prepares readers for the most important evidence. The impact presents local data showing your community meets or exceeds national levels. In Jefferson County, food insecurity affects an estimated 18% of households, 50% higher than the national average. The comparison to national benchmarks demonstrates disproportionate local need. The conclusion draws the implication: this disparity demands targeted intervention. This level of food insecurity in our community requires immediate action to connect struggling families with nutritional support. The structure makes your case that national problems manifest severely in your community, justifying local intervention. Gray literature varies widely in quality, so critical evaluation is essential before citing sources. Source credibility asks who produced the report and whether they are trustworthy. Reports from government agencies, academic institutions, and established nonprofits generally warrant more confidence than reports from unknown or advocacy-oriented sources. Consider the organization's reputation and expertise. Methodology transparency matters. Reputable gray literature explains how data was collected and analyzed. Be cautious of reports that present findings without explaining methods. Look for sample sizes, data sources, and analytical approaches. If methods are not explained, the data may be unreliable. Currency requires checking how recent the data is. Gray literature sometimes circulates long after it was produced. Verify the data year, not just the publication date. Using outdated local data undermines your needs statement just as outdated national data would. Bias potential exists when sources have interests that might affect findings. An advocacy organization might present data selectively to support their agenda. An organization seeking funding might overstate problems. This does not mean you cannot use such sources, but consider whether findings might be influenced by the source's interests. Efficient grant writers build repositories of local data sources that they can access quickly when proposals are due. Collect continuously by gathering local data sources whenever you encounter them, not just when you have an immediate need. When you find a relevant community health assessment or local report, save it to your repository, even if you do not need it today. Future, you will appreciate past use foresight. Organize systematically using a structure that helps you find things later. You might organize by topics such as health, education, and employment, by source type such as health departments, United Ways, and school districts, or by geography if you work across multiple communities. Choose a system that matches how you think about your work. Track currency by noting data years and update schedules for your sources. Hospitals update CHNAs every 3 years. Annual reports come out yearly. Knowing these schedules helps you find updated versions when they become available and avoid citing outdated sources. Share knowledge by collaborating with colleagues on local data resources. If your organization has multiple grant writers or program staff, pool your knowledge about what local data exists and where to find it. A shared resource library benefits everyone. Here is a practical exercise to apply what you have learned. Step 1. Identify the primary nonprofit hospital serving your target community. If you are unsure which hospital serves your area, search for hospitals in your county and check which has nonprofit or tax-exempt status. Larger health systems often conduct CHNAs that cover broad service areas. Step 2. Locate and download their most recent community health needs assessment. Search for the hospital name plus CHNA or community health needs assessment. It should be available on their website, often in a section about community benefit or community health. Download the full report. Step 3. Review the CHNA and find 3 local statistics relevant to a problem your organization addresses. Note the specific data points, what they measure, and their source. Consider how they compare to national benchmarks if comparisons are available in the report. Step 4. Practice writing a paragraph that combines national data from the previous lesson with local data from the CHNA. Use the setup, pivot, impact, and conclusion structure to show that a national problem manifests severely in your community. Let us summarize the key points from this lesson. Local data is the most powerful level of the data hierarchy because it proves that national problems affect your specific community. While national data establishes significance, local data makes your case concrete and actionable. Funders want to know that their investment addresses real problems in real places. Key sources for local data include community health needs assessments from nonprofit hospitals, local health department surveillance data and reports, United Way and Community Foundation research, municipal and county government data, and school district information. Gray literature from these sources often contains data not available from national sources. An effective search strategy requires knowing where to look and building ongoing repositories of local data sources. Collect data continuously, organize it systematically, track currency, and share knowledge with colleagues. Building this infrastructure makes proposal development more efficient over time. In our next lesson, we will explore how to conduct a gap analysis, identifying what is missing in the current service landscape. You will learn to distinguish between service gaps and knowledge gaps and how to document unmet needs in your community.